this issue. And it is becoming worse. I think we will request, because we have tried our best. I will tell you, even in my own county, that up to now, we have not been able to pay some suppliers.
So, moment. Your Excellency, let me, from the of statistics that we have collected together, and the logic behind the recommendations that the Ministry of Health gave to the global and African of 2.3%, which is below the global's 1,333 tests conducted, %. We have so far launched the 31st, actually the 31st of August. If you look at being reported in Kericho, if you look at automatic nation, if you remember in April, we also had a lot of import cases rather than remember this is a weekly average. The residents of Busia, but they are reported in Busia, Kisumu, healthcare workers. And some countries have got even higher than that. For instance, in October 26th, you can see that it has climbed to an average of 6. That this is not a Kenya-specific situation. This is a reported deaths in the country, 1.9%, which is also in keeping with the healthcare workers even more. And if you quickly move into the next trend, have a very literal capacity. If you look at, for example, the Aga Khan, of the middle class and upper class is to go to private hospitals. And for we have got 88 patients as highly occupied, as you can see, with an average total of 88. But there are not that many patients. And if you look at across the country, even Machako by age groups, and the percentage by age, and the irony of that is that if you look at the infection rates that we have, the infection 39%. Please take note of that figure. That 52% United States of America, and it will get worse as we move on. Then they will be the reagent situation
that is changing because of relaxing some of the containment measures. Picture of a situation that requires, as the President said, that will slow down the infections, minimize the deaths. I will join everybody in saying, let us make the decisions.
Thank you very much, Deputy President, for those comments. Now we will move. I want to hear from the Interfaith Council.
Something that we cannot remain in denial about the reality that faces us. This has been reinforced by utterances by politicians. Whereas in general, and perhaps this is where we may need to engage to the religious leaders, has been totally ignored. Our indication not to serve food as well, we should not have any foods served in any gatherings, religious or otherwise. Because it is in these moments be the enforcement of wearing masks in our public space and in the social distancing in public. The masks have been fairly well followed.
For the management of the pandemic, the Public Health Act has been in
submission. Thank you very much.
Our recommendation is that we amend the Public Health Act 243 of the Constitution. The other,
an upsurge and anxiety in the counties and in the country as a
management and infection prevention and control. Since flattening of the curve, effort towards case management slowed down due to inaccurate and falsified information recorded by persons moving from one place to another. This has affected contact tracing, and this has led to increased community infections and the number of patients under home-based care. Your Excellency, on matter of policy, legal, and regulatory response to to the pandemic, all the 47 county governments have medical insurance cover as required by the Labor Relations Act. To this end, county workers on NHIF are covered for COVID-19 and in designated health facilities. On the other hand, private insurance companies are not covering COVID-19 expenses. In this regard, hospitals have continued to demand hefty amounts ranging from 2,000 Kenya shillings to 600 Kenya shillings before admission of COVID-19 patients. And this is in respect of private hospitals. As county government, we request the national government to regulate health insurance in the country in the wake of COVID-19 by providing a policy and legal framework within which COVID-19 patients have to be accessed medical attention. It is unacceptable, heartless, and unethical that the private insurance companies who have been paid colossal amount of money now deny disparate Kenyans access to medical care, demanding more money from the already overburdened population. This has to change. Your Excellency, in view of the gaps highlighted above, the Council of Governors recommends the following. All containment protocols developed, they implemented in their original form. All containment protocols developed be implemented in their original form. We further request, with your intelligence, Your Excellency, that the national-wide curfew in force be varied from 11 p.m. to 9 p.m., starting at 4 a.m. for at least 1 month until the curve completely flattens or positively rate fall below 5%, whichever is attained first. We cannot talk about economic recovery without addressing the virus. The reality of the rising cases forces us to act because Kenyans are expecting us to act to save lives. There is never a perfect time to act, but it is now. Strengthen collaboration between national and county governments to ensure that all health containment and related protocols are enforced. As county governments, we commit to ensure adherence to the set protocols to avoid the spread of the virus. All counties will utilize their county enforcement officers to work closely with the police and complement their work. Both levels of government to ensure all health workers, including community health volunteers, have access to full and quality PPEs to circumvent vulnerability of health workers in their response. National government and county government to embark on a rigorous civic education campaign on the effect of COVID-19. This will help us to prevent medical and moral disaster. We'll get through this since we have done it before, but we must act now. Additionally, members of the public, including politicians, should be penalized for flouting the health protocol. Your Excellency, as county government, we are beginning a campaign today dubbed No Mask, No Service. Bila barakoa, hakuna huduma. County governments will translate this campaign message in their local languages to ensure that every Kenyan is sensitized. The campaign will affect services in the country, and anybody found rendering service to members of the public who are not complying with the health protocol by wearing a mask, keeping distance, and sanitizing will be held liable. Indeed, today's meeting is timely as it gives us an opportunity to review the efficacy of the containment measures in place and the impact of the easing of the restriction in light of the resurgence of COVID-19 infection, which has been termed as a second wave by health experts. Your Excellency, whereas county governments has continued to enhance their response measures toward the fight against COVID-19, the increased number of infections has strained the health systems in the counties. Currently, a number of counties are running on a full capacity in their isolation wards, ICUs and HDUs, meaning therefore that county government can no longer admit new patients. It is actually an acute crisis. Many patients are losing the battle en route to Nairobi to seek treatment. We shall be asking that we re-examine the easing of restrictions and re-strategize on the containment measures in the wake of the emerging new increased infections and fatalities. We are heading to breaking point because it is things that are raging out of control, and we are not able to transfer patients even from one county to another. Your Excellency, on the state of preparedness of the county government, today I will focus on the gaps in the counties which, if not addressed urgently, will threaten the gains made thus far. One, inadequate infrastructure. So far, 12 counties have not attained the minimum 300-bed capacity. With the increasing number of COVID-19 infections, these counties will not have capacity to handle COVID-19 patients. Further, 11 counties have less than 5 ICU beds in their isolation facilities. This is a major challenge for patients who may require ventilators and supplemental oxygen support. Number 2, restrained human resource. When the country eased the restriction on 28 September 2020, there was 1,038 health workers infected. Currently, an additional 627 health workers have been infected, bringing the total to 1,665 infections. This has affected optimal service delivery to COVID-19 patients. Further, before the reopening of the economy, 16 health workers succumbed to COVID-19. We now have an additional 3 deaths following the opening of the country, bringing the total number to 19. Due to increased cases, the healthcare workers are overwhelmed and barely managing. We are running out of healthcare workers, and this means that patients' care will suffer. Number 3, closure of county institutions and facilities. Due to the upsurge of COVID-19, more than 80 county assemblies have been closed. In addition, 16 counties have closed various county facilities and departments, while others have scaled down operations. This is just what we have, but the situation is unfolding on a daily basis, and it all points towards closure of one department or institution. This means that either way, when the virus sneaks into an institution or department, we have no choice but to close down. Worse still, we have to test all staff, yet there is acute shortage of testing kits. Number 4, non-compliance of COVID-19 protocols. Since the relaxation of the containment measures, there has been laxity in the enforcement of existing protocols, especially in the transport, entertainment, trade, markets, and tourism sectors. Further, members of the public have continued to disregard protocols relating to places of worship, funerals, and weddings. The political class has also continued to be the super spreader of this virus, especially during their engagement. This has significantly contributed to the escalating COVID-19 cases and collapse of the contact tracing effort due to the numbers that attend political meetings and those that socialize in bars. Number 5, insufficient.
And if people have backslidden from the resilience they showed during the first few months of the pandemic, they do not expect us leaders to backslide as well. And if the nation is succumbing to the fatigue created by the virus, it would be a tragedy if we as leaders give in to the weariness as well. And if the people have fallen short of giving their best, we as their leaders have to give our best. This moment provides a unique call to leadership. Although health interventions are critical to fighting the rising COVID numbers, leadership is what will reverse this escalation. And you, as the leaders of our 47 county governments, all know that leadership is not a position, it is the actions that we take. In a situation of crisis, action also means knowing the way, going the way, and showing the way. And that is what is expected of us as leaders, both at the national and county level. And I am persuaded that if we exercise collective leadership in this fight against the pandemic, we will reverse the upward surge of new infections. And while at it, we must not be pushed to make popular decisions to appease the public. We must choose the bold over the popular, if that is what shall serve the country better. Ladies and gentlemen, I want to identify only 3 elements of collective leadership that we must engage in. In choosing the 3, I am cognizant of the fact that health interventions are critical to our fight against COVID-19. However, the paradigm must now shift from emphasis on health interventions to underscoring the management of human response to this pandemic. We must ask ourselves whether we have done our best to contain its spread. Then we must ask further whether what we consider to be our best is enough. Are there areas we fall short, and could we have done better as governments? We must ask ourselves, from the time we opened, did we backslide from our vigilance when we started flattening the curve? And are there lessons that we can learn from this relapse that has occurred during these recent months? If we are experiencing an escalation of infections countrywide, it is not because our healthcare system has failed. The crisis is as a result of failure to manage our human response to this pandemic, and this is what this conference must address. The first element of leadership that we must focus on is compliance and enforcement. If this summit is a fellowship of truths, we must admit that there is a collective failure in the area of enforcement. Although the wearing of face masks in public is now a statutory requirement, we are facing enforcement challenges across the 47 counties of Kenya. Yet the World Health Organization has approved a faster way of testing COVID-19 using pre-qualified anti-agents that give you faster results in your locality. So instead of sending samples to other counties, each county can use this WHO intervention to localize testing at the county level. But for this to happen, leadership has to kick in. Leadership at the county level has to know the way, go the way, and as I said, show the way. It has to identify the solution provided by WHO for quick testing, acquire it, and implement it on the ground. The quick acquisition and deployment of the WHO pre-qualified testing kit, I believe, will make the difference, and we must make it prevalent in our counties as part of our collective leadership and responsibility. The third element has to do with our immediate irreducible minimum. Yes, we can manage the human response to the pandemic through enforcement and early response. However, this has to tie back to what we identified in March as our COVID-19 irreducible minimums. Although this is not part of the human response, Leadership in ensuring that these minimums are met is critical. We must be truthful to ourselves on this. Do we have the irreducible minimums to handle the turns and twists of this pandemic in our counties? Do we have enough isolation beds, ICU facilities, oxygen equipment, and the bare minimum of 300 bed capacity? If we have to meet these requirements, should the pandemic demand that we expand our health facilities in the coming months, do we have what it takes to do so in a speedy and timely manner? The question I want us to ponder in this conference is, do we and are we prepared for the upsurge that is likely to happen? I have one last point of reflection, and I want to invite you to consider this in the summit. The COVID-19 has put pressure on our education system and calendar. Collectively, we need to come up with leadership solutions that provide us a feasible way forward. This will not be a national government affair only. It requires the involvement of all of us. As we deal with enforcement, early warning and response, and ensure that the irreducible minimums are in place, we must not leave the education sector behind. Innovative thinking on how to reopen our schools and learning institutions must be a shared responsibility between the national and county governments. So therefore, colleagues, I invite this summit to make bold and once again, maybe not so popular decisions